first week of internship has been hard. Let's do a 90-second journal club and break down the Aristotle study, in which Warfarin was compared to Apixaban in patients with Afib and stroke risk factors. Here's some quick background info. Patients with Afib are at an increased risk for stroke and have been traditionally treated with anticoagulants like Warfarin or other vitamin K antagonists. However, these drugs aren't the best as they have a limited therapeutic range, have drug and food interactions, require monitoring, and have an increased risk of bleeding. Apixaban, a direct oral factor Xa inhibitor, was shown to reduce the risk of stroke or systemic embolism by 55% without increasing the risk of bleeding in patients unable to take warfarin. Back to the Aristotle study. The study compared Apixaban to warfarin in the prevention of stroke or systemic embolism in patients with Afib and stroke risk factors. They found that Apixaban had lower rates of stroke or systemic emboli, meeting the threshold for superiority for the primary outcome. They further broke that down, in which the major effect was on hemorrhagic stroke but not ischemic stroke. Additionally, patients had decreased mortality rate in the Apixaban cohort. In terms of safety outcomes, Apixaban had lower rates of major bleeding overall, according to the ISTH, Gusto, and TIMI definitions. In summary, Apixaban was superior to warfarin. It decreased stroke or systemic embolism risk by 21%, major bleeding by 31%, and mortality by 11% compared to warfarin.